This is podcast about stress and coping, part 2. I'd like to take a moment and talk about compassion fatigue. And a lot of times we hear about nurses get burned out, and that has to do with compassion fatigue. Sometimes we all can also call it secondary traumatic stress, which is the trauma that healthcare providers experience when witnessing and caring for others suffering trauma. And it can take a toll on you and definitely poke at your emotions. Again, there's a video in the presentation that I would like you to watch. But burnout is the condition that occurs when those demands really outweigh the resources. So when a nurse feels like the demands of caring for people outweigh the psychological resources that he or she has, then burnout can occur. It is a state of physical and mental exhaustion that often affects healthcare providers because of the nature of their work environment. We also see episodes of what we call lateral violence, which refers to, in our case, healthcare workers or providers engaging in bullying or potential assaultive behaviors toward coworkers. That can really happen in any type of work situation, not just healthcare, but we do see it a lot in healthcare. The feelings of hopelessness and anxiety from compassion fatigue can result in feelings of inadequacy and low self-esteem, which can then lead to lashing out to others in an attempt to cope with the feelings and the stress. And I want you to think about what are some strategies for coping with workplace burnout. What type of social support or groups can help with that? Who are positive role models? And how can control over your work environment help prevent burnout and compassion fatigue? And also making sure that your home life is separate from your work life, where you can remove yourself from that work life and take a break from it. When we look at coping strategies of older adults, there is a good bit of information in your textbook here that you should take a look at. How have you seen older adults handle stress and coping? Think back to your clinical experience or relatives. Sometimes older adults use a pattern of coping that relies on interaction. They can be partners, friends, or family members. A lot of times older adults have issues where they need help, and they often find that with the interaction. Older adults like to organize their environment. They also have a lot of life experience with stress management and coping, and maybe they've done that well in the past, maybe they haven't, but they have a lot of life experience to back up what they're feeling. They tend to make positive comparisons. Something similar happened in the past, and now this is happening, and they can do all that critical thinking involved to create their coping mechanism. And again, they often use interaction or two-person coping rather than just taking it all on themselves. When we look at assessment, indicators of stress and what we're really looking for assessment. Physical indicators of stress include affecting the cardiovascular system, tightness in the chest, increased pulse and elevated blood pressure, respiratory, breathing more shallowly and having tachypnea, neuroendocrine, headaches and migraines, fatigue, exhaustion, insomnia or other sleep disturbances, feeling uncoordinated, restlessness and hyperactivity, tremors, profuse sweating, dry mouth, cold hands and feet. Gastrointestinal, genitourinary, could be urinary frequency, nausea, diarrhea, vomiting, weight gain or loss of more than 10 pounds in a short time, change in appetite. Some people use food to cope and other people don't want to eat. Even gastrointestinal bleeding. You might see blood in stools or vomit. You might see elevated blood sugars, elevated cortisol levels. Musculoskeletal, backaches, muscle aches, clenched jaw, slumped posture. Reproductive, stress can cause amenorrhea and failure to ovulate, impotency in men, loss of libido. And it can also cause frequent or prolonged cold, flu, other types of infectious diseases. Psychological indicators of stress, forgetfulness and being preoccupied, denial, poor concentration, inattention to detail, orientation to the past instead of to the present, slower thinking and problem solving, slower reaction, learning difficulties, apathy or not caring, confusion, decreased attention span, problems doing math, memory problems. Emotional assessment, disruption of logical thinking, blaming others, lack of motivation, crying, lack of interest, being irritable, being angry, being diminished, just lack of motivation. Behavior, being worried, withdrawal from others, change in interaction with others, over-vigilance to the environment, excessive humor or silence, and any big change. When we do a focused patient assessment about stress, we need to look for indicators of anxiety, anger, and tension. We can ask some questions to do with safety. Describe for me any thoughts you might have of harming yourself. Ask about sleeping and appetite. How does stress affect you? Have you had any accidents at home, in the car, or on the job? When we want to ask about perception of stressor, we ask, what do you think is stressing you? What do you think about when you can't sleep? And we can observe the nonverbal communication. We can ask about available coping resources, friends and family, support system. How have you coped in the past? What do you do for fun? And in that regard, we can observe if the patient is always alone, if they're able to ask for help, what is their developmental level, and what is their cultural circumstance. If we are assessing maladaptive coping, we can ask about smoking, drugs, drinking, and most people are pretty honest about that. And we can observe for the effects of all those things, physical effects. And then we can ask about adherence to healthy practices. For example, how often do you have a health exam with your primary provider? Do you eat regular meals? All those things. Examples of different nursing diagnoses we can use for stress and coping. We have compromised family coping, ineffective coping for a single person, readiness for enhanced coping, stress overload, And we can always use anxiety, fear, hopelessness if we need to add those in as well. We have 3 modes of intervention. Decreasing stress-producing situations, increasing resistance to stress, and helping learn skills that reduce the physiological response to stress. We definitely want to be educating patients and families about the importance of health promotion. Sometimes that can decrease the effect of stress. So in primary level of prevention, nursing interventions include preparing patients for big events in life, such as having children, death of a spouse or parent. Secondary level would include actions directed at symptoms such as protecting the patient from self-harm. And then the tertiary level interventions help your patients readapt and often include relaxation, time management, meditation. There's a really good box in your book that has examples of patient teaching for stress reduction, like exercise, relaxation, support system, counseling. Definitely want to make sure that you ask people, what do they do for stress reduction? Everybody has stress, and we want to make sure that people feel empowered and in control of their own life. And sometimes they need to have some assertiveness training, or remembering that they really enjoy listening to music. And sometimes people just get into a stressful situation and they forget about those things. Lastly, we will just want to touch on the topic of resilience. Some people will call this grit, but it is the capability of a strained body to recover its size and shape after a deformation caused by a stress. The ability to recover from or adjust easily to a misfortune or change. So as nurses, we have a chance to help people build their own resilience. A lot of times people will have a lot to overcome when it comes to this topic. They don't have a lot of resources, whether it be economic supports. Think of somebody who is trying to give up smoking, but everybody in their world smokes. And how can we build resilience in them to really work on that habit when they're in an environment when a lot of people have that? And so there's a video in the PowerPoint that I would really like you to watch. And that's it for Stress and Coping.